planning skills and your organization and your speech. And then we also have that emotional center, which is also very important to be able to help with anger control, self-concept, motivation, alertness, understanding other people's perspectives. So these are all areas that need to be addressed when you are looking at truly helping an individual become self-regulated. And within that framework, we can look at sensory supports. We can look at, which is in that sensory physical domain from above. And when we look at executive thinking on the lower left, those are some strategies that can be also utilized, or what we call thinking strategies. So those are the more kind of cognitive regulation strategies. And there's also calming techniques, which are more in the emotional realm. I have highlighted the top circle for tonight's purposes because this is an area that as an occupational therapist we tend to have expertise in terms of helping utilize sensory supports, and these can look like a certain bike or a roller racer, deep pressure exercises or games, therapy ball, trampolines, headphones, using a vest, using focus tools like a stand-up desk or a cushion. And these can be the types of inputs or tools that maybe you've acquired for your child or you've seen them use at school. So we're going to be really talking with an emphasis on the sensory supports, but I truly want to acknowledge that the thinking strategies and the calming techniques are equally as important. It just may be that there are other individuals on the team for your child that may be focusing more in on those. But certainly as occupational therapists, we try to have a balance within all three domains, because one cannot work independently of the other. So this slide here is to really emphasize that if you look at the bottom circle, we're looking at the ideal state, the calm and alert state of self-regulated. And this is where you're focused and you're ready to learn. If you look at the very top, you look at the dysregulated state, and that's the child who's tuned out, or they're melting down, or they're very disengaged. The bridge, or the middle arrow, is really emphasizing the requirement of the collaboration with families, with school, with caregivers, having sort of a pre-planned sensory activities to help that child obtain balance. So that bridge between a child who's dysregulated and that objective of having them calm and regulated really is that co-regulation phase. And this is where I think all parents and educators are really trying to establish where is that role. And this is the piece that we're hoping that you will acquire some more skills and tools to be able to provide that for your child. So what do we really know about self-regulation? There's a lot in the research, but I think some key points are really recognizing that we can have decreased impulsive reactions, which lead to more mindful and more positive strategies, which ultimately lead to increased self-control. We already discussed that the sensory and the cognitive and the emotional, all of those three domains together, they all work collectively to increase adaptive behaviors. And it's very unrealistic that those three circles are going to overlap at a proportionate amount. So there may be one moment in time where emotion is taking more of an emphasis, another time when sensory is, or cognitive. So those are always fluidly moving in combination with each other. We also know that self-regulation skills are found in the right side of the brain. So this is our calming center. And there's been research that has shown that higher levels of cortisol in the mother's brain during pregnancy can increase behavior and stress in children. And we also know that trauma of all types can resemble sensory processing disorders just due to the varied arousal levels that a child can experience. And we also know that that early attachment and bonding phase also really helps increase self-regulation. So the pyramid of learning is something that for our discussion tonight, the sort of keeping the focus on the internal information of this triangle is the key, because what this is trying to emphasize is that the foundation of all learning, and that is social learning, that is play, that is academic learning, it's learning how to put shoes on, it's every aspect of learning in life, is really hinged on this strong foundation of our sensory system. So there are 7 sensory systems through our smell, our sight, our hearing, our taste, our touch, our balance, and our body awareness. And if we have irregularities in those 7 domains, which are our solid base of our pyramid here, that can affect performance and acquiring the upper level skills. So then if you move to a sensory motor development level, which is the next chunk in this pyramid, so if you have difficulty with understanding your balance, you're not going to necessarily have very good postural security. You may not have good awareness of the 2 sides of your body. It may be very difficult to have those reflexes from birth mature. You may have extreme startle reactions, for instance, and it's very hard to screen input and hard to learn and generalize motor skills. And then if you move upwards, you then move into a perceptual motor domain, and that's where our auditory, our language skills, our eye-hand coordination, our ability to move our eyes, our postural adjustment, and our perception visually and spatially, and of course our attention. So if those 3 levels are having performance difficulties, it's very difficult to acquire daily living skills, modify our behavior, and at the very top, access academic learning. And I feel it's very important to think about this as accessing, because in order to really have that enhanced enriched learning environment, there has to be attention given to these different domains, and there may be different professionals impacting or supporting you, or these may be areas that you're just tackling yourself, which is equally as beneficial. But all of these areas have to be looked at if we're going to maximize learning. Sometimes this is a very nice pyramid to sort of just have in your back pocket during a discussion with the school, because this really helps in an instant allow the school to be able to say, oh, they have like a bit of an aha moment or a light bulb experience where they think, wow. And I know that some of the special education resource teachers find this very useful to be able to help educate their colleagues to really realize that, you know, if a child hasn't established, say, hand dominance, for instance, which is a perceptual motor skill, then maybe there's something else going on in those lower areas of their sensory system. Maybe they're very hyper responsive to touch and don't want to touch a pencil, and there can be lots of different types of things can impact that. So keep this little picture in your back pocket eventually when the slide deck is available for you in those communications with school. So sensory processing is this sort of fluid term that is used, and people don't really have a very good sense of what this means. But really, we need sensory processing for everyday life. And this promotes our comfort, our optimal ready state. It helps organize our nervous system. And really, it's all the information from our 7 senses are coming in, and then we create a reaction outward. So if there's a distortion in those senses coming internally, then we will then feel dysregulated, have less self-control, and then this is where a lot of impulsivity and negative reactions can result. So sensory integration, if we look at that term, it's really being able to take those 7 senses and being able to merge them and sort of embed them together. And this allows the sensory experiences will help guide our actions and our responses. And our brain needs this information on a continuous basis. It's how it fuels, and it's how it operates and organizes. And it creates this map of our bodies and ultimately a map of the world, because if we don't have this information and we're not interpreting it properly, we don't have an understanding of how to navigate in the world with regards to our reactions and our behavior. And so the daily decisions that we make are always impacted by that sensory input that we can manage. So, you know, there may be a day where you come home from work and you're finding that, you know, it's just been a chaotic day, and you find that, you know, you maybe have less tolerance for either dealing with your wife or your child or your brother, your husband, and that's because you've already kind of saturated yourself. And so you may be a little more irritable, you may be a little more easy to sort of have a reactive experience. And so it's a fluidity that happens, that it's like an ebb and flow where it's always moving. So we do have to acknowledge, though, that this does affect our behavior. So when there's a dysfunction, that's really that inability to process the information through those senses. So it's like a bad cell phone connection. And this can lead to difficulty in daily functioning. And of course, there's a continuum where, you know, there may be a day or even a whole child's experience that is more on the mild end of the continuum versus more severe and just cannot function. And this speaks to the fact that, you know, even with a diagnosis, it never looks the same for any one person. And with or without a diagnosis, it's irrelevant. It's really about how it impacts the function. But it definitely can range. And so what happens for one child cannot be generalized to another. So these are just a list of some of the types of diagnoses, because parents and educators are often asking me, you know, what kind of individuals can have sensory challenges? And I want to speak to the fact that there can be a typically developing child or adult that can have the same, you know, that can be very sensitive to noise or very sensitive to light. But in terms of the sort of more classifications of children, it can be children on the autism spectrum. It can be children with developmental delay, attention deficit difficulties, learning disabilities, developmental coordination disorder, which is one that often people haven't heard of. And that's for lack of a better term, the old traditional term is like the clumsy child, Fragile X, fetal alcohol syndrome, auditory or visual disorders, brain injury like seizure disorders, and as I mentioned, typically developing adults and children. So we use these 7 senses to form our behavior. And I think we would all attest to the fact that our behavior is sometimes classified more as a reaction. And often we have to turn that term around to not be thinking of it as a negative behavior, but it's more a reaction to what's happening for them within their brain. So I mentioned that in that base of that learning pyramid that we have 7 senses. And I think that most people understand the top 5. So the touch is really the sensors that help keep the brain informed through the skin. So if I touch a hot element, you know, my brain is going to tell me that that's hot, so I move my arm. That's the receptors that are happening. And then our movement system tells us where our body is in space. So if my foot goes a little too far on the set of stairs, I know I'm going to stumble. Our body position, which is really our muscles and our tendons and our joints giving us information about where we are in space, helps us know that we're up, you know, we're standing upright, that we're leaning a certain way, and gives us a sense of gravity. And our oral is really the sensors that help log daily experiences of things going into the mouth, food or objects, and really is about pleasurable or non-pleasurable experiences. We will always remember when there is something that is not pleasurable, and our children will as well. And our children may classify that as not pleasurable because of the texture, it could be because of the temperature, it isn't necessarily just because of the taste. And then we have our auditory, which is really, that helps map the distance around us. So if I hear a sound down a hallway, somebody's calling my name, and it's quieter, I know they're further away. Whereas if it's really loud, I can suspect that they're right behind my ear. And that can often be a startle reaction for children. And the visual is how we map that space around us. So if I can see you coming straight at me, I can cope better with your presence. Whereas if you come up behind my back, that is also a potentially alerting experience as well. And our smell helps us also map those pleasurable and non-pleasurable experiences. So these receptors, all of these sensory systems, all provide information of how we form our behavior. And then the key kind of calming sensations that are good to know about is that we do get lots of that calming input through our joints and our muscles, and that heavy work, that rough play, that squeezing, that hugging, and getting a lot of that input through our body, as well as that linear movement. So back and forth and up and down, the child who wants to bounce on your knee repetitively, or wants you to swing them, or wants to sit in a rocking chair with you, and having that linear back and forth. Those are the inputs. And, you know, the swing at the park, those are the movements that children often feel very calmed by. And then deep pressure touch to the skin. So they're the child that like you to squeeze their palms, or squeeze their shoulders, and give them lots of that nice deep pressure. And then the oral input, so lots of biting, chewing, blowing, sucking, those kinds of inputs are, and often the oral is usually a sign of self-soothing. So when one of the sensory systems is not well balanced, then often the oral system kicks in and says, hey, what about, you know, what about me? You know, I'm not coping. And so then we can see more of that sucking on the shirt, you know, chewing on the clothes, so that as more of a stress response and a strategy that the child has acquired to self-soothe. So with our nervous system, it's important to know a little bit about how our nervous system works, because we have two aspects of our nervous system. One is our kind of fight or flight, and then the other system is our calming. So obviously we want to have more calming, but our reality is usually our children are in a fight or flight state. And this is because our sympathetic nervous system is usually overreactive with children with sensory processing challenges. And the main emotion is usually fear. And when the central nervous system is unregulated, we're looking for danger. So they could be scared of a toothbrush and the way the toothbrush feels. And, you know, it seems like a crazy experience for a parent to, you know, to say, how can my child be afraid of a toothbrush? But it is very much, if the input is not being felt in the way that maybe it is for you, and it's feeling prickly, then there can be that fight or flight response. And the parasympathetic nervous system is really that calming component. So this is usually underactive in children with sensory difficulties, and they have less ability to find those self-soothing, and so they will often resort to things like sucking. And that's not the only thing. They may resort to touching as well, but the main idea here is that, you know, as well-regulated individuals, we usually find those things that help to calm us, whether or not it's a walk, or touching our dog, or having a coffee, or a chocolate bar, whatever it is that works for you, quiet music. But for children, they have a hard time being able to acquire these systems. And sometimes their chosen calming responses are not ones that are always safe or functional. So the other aspect about understanding about sensory regulation is that, and I think this makes sense if you think about your own child or a child you work with, and you think about, you know, we can either actively do things in our world, or we can passively sit back and almost be like a sponge. And I think we all do both of these things at all times. But for children, what happens is that they, when a child does something, physically does something, they move, they put their hands over their ears, they walk away, they walk towards, these are things that they're actively doing to get the input that they want. Then you have your children with passive responses, and they just sort of let the world happen around them. And I say that because it's sort of like just absorbing like a sponge. And then all of a sudden something happens to, it doesn't have to be a very obvious thing, but something could happen. There could just be like a certain sound in the room that just sort of is the last straw, and then they can have a very unproportionate reaction. This is usually harder for people to deal with because they think, well, there wasn't any trigger, but there probably wasn't in that moment. It's just more of an accumulation over time that they have just been taking in, and then eventually their cup is full. So that's the idea, is understanding that there's active and passive ways to control our responses to input. Now, this little section here that we're going to talk about is certainly not meant to overload you with information, but time and time again, parents have gone to these kind of talks or information sessions, and they're looking for the strategies, and they want the answers and the tips. And I acknowledge and I promise you're going to get lots of those. But I feel like the best way that I can empower you is to really help you understand how to interpret what's happening. So without going into tons and tons of theory that we as occupational therapists use, I wanted to kind of make this in the most simplest way possible, but I really want you to think about how this may impact your child, because the better of a detective you are and the more you understand, the more likely you're going to have a better way of finding strategies for your child. So we talked about the active and passive. Okay, so now we're going to talk about what we call kind of hypo and hyper responsive. So the best way I can make this analogy for us is that there's some people in this webinar tonight that they can just drink cup after cup after cup of coffee, and that makes them feel just right. They feel alert, they feel, more on par with, doing their work. They feel more satisfied with having lots of coffee. There's other people like myself that I'm a little sensitive to caffeine. So if I have more than 1 or 2 cups of, probably 1, if I have any more caffeine than that, then what happens is I start to get headaches, and it sort of, I kind of reach my threshold. I'm more sensitive. So I want to relate this to the sensory aspect. And if you think about children who have this big cup, it means that they need more, that they can digest lots of on the go, rocking, moving, bouncing, running. They are just always on the go because they have this large appetite. We call that a high neurological threshold. It just means that you need more. So the child who can stumble down, the slide at the park and just get up and go, and you're holding your breath as a parent thinking, oh my goodness, did they hurt themselves? But they just carry on. Then, in contrast, you have the low threshold or that hyper responsive child who maybe falls down 1 step and they're having a very big reaction because they only just need a little tiny bit of input before they feel overloaded. So this is the idea, and a child may move away from noise or touch, or they may want to move away from certain clothing seams or clothing textures because they feel everything and they feel it quick. So you have both the big cup and the little cup idea of in pertaining to that appetite and that amount of sensory input that you need. I think we often think that most children need more, but I want to validate that there are children who need less. And these can be within all of the 7 sensory domains. So you can have a big appetite for movement, but a very low appetite for touch. So in order to understand your child's behavior and your own and the child's sensory profile, I feel like by showing you this next slide, it helps you learn that there are kind of 4 quadrants. We're going to pull these concepts together in this next slide, and then I'm going to demonstrate some examples so that you will better understand. But there are basically 4 main patterns that we often see children falling into, and we call them the quadrants, the sensory quadrants, and it helps us to better analyze a child's behavior, and it helps us to be more mindful and interpret the reactions. So take a breath. I know this is a lot of information here, but I want to take your eyes to what we've already covered. So look at the far left side, and we have our high threshold and our low threshold. So that big cup of coffee and that small cup of coffee. Along the bottom, we have that passive and that active. So we've already covered that the passive is really doing nothing, just absorbing, and active is doing. So these 4 categories are kind of like as I mentioned, they're like the common profiles that kids fall into. And this is a slide that parents, if they can sort of review and educators can look at, they can often start to identify their children. And so I want to start at the top. So the bystander is the child that looks kind of self-absorbed, takes a lot of time to respond. You may have to call their name numerous times. They may not notice information. They're kind of oblivious, and they need more input to notice things. So either a stronger taste, a stronger smell, a stronger touch. So these are kiddos that have that big cup to fill, but yet they just kind of stay back, and they're kind of passive, and don't really do much to change their experience. On the contrast, on the top in the red, we have the seeker. So this child also has a big cup to fill. They're the ones that crave lots of input, rocking, tapping, swaying. They like change all the time because it gives them new input. They enjoy extreme sports or playgrounds. They like spicy, crunchy, sour foods. So this child not only has a big appetite to fill, but they also have an active personality that makes them just go get what they need. If you then flip that to the bottom and we think about our sensitive sensor, so this is our child who will comment. And it's funny, I've met 2 children this week that are a sensitive sensor, and they will notice everything, any small change. They'll notice that Sally is not in class today. They will notice that you used a different shampoo. They will notice that the desks are faced differently. They will comment on sensations, clothing. They will be more sensitive to their clothing being itchy, because remember, they have that small cup. So they get triggered very quickly, and they're that sponge where they just sit and they passively absorb. So the avoider, which is the 4th category, they also have a very small threshold. So it doesn't take them much to fill their cup, but they're very active in doing what they need to do to get their needs met. So they may have very narrow food choices, and they really steer away from things where they haven't had success. They prefer control. They like order and routine. We all know this may spill over into work avoidance. They are not open to trialing new things, and solitary play is their preference because they really don't want to have to share their ideas. They want to be able to be alone because they want to control the outcome of the play. So you can have a child who's a bystander, a seeker, a sensitive sensor, or an avoider. And once again, within all the 7 domains of that can sound very overwhelming. I appreciate that. But maybe these examples can kind of help you understand. So if we look at our tactile system, this is where we have that small cup. We don't need a lot to fill us up. We are extremely sensitive to light touch. So the hair follicles on our skin are actually what feels touch first. So a certain fabric is going to be very alerting or very distressing. And children like this can also resist hand over hand. So you may think that that will help them with hair brushing or writing with a pencil, but they don't like that touch on their hand and they pull away or have an adverse reaction. It may not be because they don't want to do the printing job. It may be because they just don't want the hand over hand. They dislike crowds. They don't like standing in line, staying in their seat. They dislike personal hygiene. I'm sure there's parents in the group that would attest to just the hair brushing and the hair combing and the showering. These are all difficult things in narrow ranges of clothing. Whereas that child who has that big cup and needs lots of that to kind of fill their tank, they are needing to their tolerance to pain is really big. So they don't notice small bumps, cuts. They can, like I said, they can fall down the slide and not even notice. Self-injurious behavior like picking or hitting, mouthing toys, seeking lots of pressure, like launching off the kitchen table, launching off the desk in the classroom, stomping their feet. They don't feel food on their face, and they like to fit their body into small spaces and may lay on the floor. So our tactile system just wants more input in that on the hypo side and wants less on the hyper side. For that proprioceptive system, it's important to know which is your muscles and your joints, knowing your body position. A child that's hyper responsive or needs less information, they tire easy, they lay on the carpet, they have a difficulty staying in one position, they look sleepy after a while, they don't like to hug tightly, they have difficulty putting their legs in their pants and sleeves and their arms in their sleeves, they press the pencil too lightly, difficulty holding a spoon or a pencil. So they're really struggling with really understanding where their body is in space. And then you have those children who also have a challenge of understanding their body in space. However, the difference is they're doing something very active to get that input. So they're chewing on things, they're slamming doors, they're crashing into classmates, dropping objects, seeking tight spaces, play rough, hang on things, self-hitting, self-stimulation, jarring their joints, like launching off your couch, which I'm sure none of you have experienced, and breaking crayons. And that's another really common one. For children with that sort of vestibular system, that movement system, the kids that need less, they really, so it's when a child hasn't had an occupational therapy assessment and parents or schools are trialing things, often movement is where it's people's first go-to. They want to provide more movement. And I hope that this will help you see that sometimes for those hypo kids, so off to the right, the seekers, they're the ones that have that high appetite for movement and love the bumping and the crashing and the rocking and the spinning. But I want to tell you that there's a group of kids on the left that have that small cup to fill, that they feel very vulnerable when their feet are off the ground. Movement is scary. You know, when their head position changes, they feel very disoriented. So, you know, you may think that throwing a child on a therapy ball is going to be their, you know, their wish, but in actuality, it can be very scary. So sometimes children will not gravitate to movement, and it's really important to respect that and to appreciate that, especially when you're doing a trial and error of activities, which we all do. That's how we learn. Visual system. So that small cup is things like the visual clutter. So things like too many objects in the space the child is trying to do something. So in their rooms, in the classroom, too much clutter on the border of their piece of paper. They really can have a preference for one color or pattern, poor eye contact, and really scared of the dark or bright lights. Whereas you have that seeker, that child who wants more, they like mirrors and water and watching movement, objects move and spin, and they stare at bright lights and flashing objects. So there's quite a contrast of how your visual system can be responding. And then your auditory, when you have that small cup, as I'm sure as many can relate to, when you go to work all day and then you come home, if you're working outside of the home, or even otherwise, if you're in the home and you have been, you know, doing things in the daytime, and then all of a sudden a surge of noise come in after school, the kids come barreling in, it's that sudden noise, it just puts you over the edge. And for a lot of kids, it can be the fire alarm. They will react by putting their hands over their ears or cupping their ears, difficulty hearing instructions within a group, and they may become the loudest of the group because they're trying to fill their ear canals with familiar sound to self-soothe. So they want to camouflage the undesirable sound. And that's a really important distinction that I find sometimes people will discredit hyper-responsive reactions to sound because people think of it in the stereotypical way of just putting your hands over your ears, but sometimes kids can be the loudest of the bunch. And the hypo-responsive kids are the ones that once again, they have that active tendency to find things. So they want toys that make noise and repetitive sounds, and they want to hear their echo in the bathroom, in the gym. They seek vibration on their ears or on their face, and they really need their names to be called louder or with a clap or some kind of a way to kind of get them to register the information. And our good old taste and smell system. This one is children that have that small cup to fill and are quite passive. They can be the picky eaters. Their gag reflex can initiate really quickly. They can avoid brushing their teeth. They can have intolerance of smells. They can be really sensitive to smells, and they can avoid bathrooms even because of smell. And that could be not just because it's, you know, a bad smell. That could just be a certain deodorizer that the child is responding to. And then when we have that big cup to fill, they're going to seek out strong smells and strong tastes, and may lick and smell things or initiate more drooling because they enjoy the feel of their saliva. And this can be one where I've had children that, you know, they can be bum pickers and ear pickers and they like the smell of their orifices. And, you know, it's just being able to recognize it's not a gross thing. It's just being able to find a replacement strategy, recognizing that they like the strong smell. So maybe things like strong scented hand sanitizers, essential oils, things like that on their fingers can replace some of those what we call, you know, dysfunctional or unsafe types of behaviors. But it isn't always just saying no. It's often finding a replacement. And that's where you, being the detective, as the educator or the parent or the caregiver, is really being able to say, okay, what's happening here is telling me something. And I need to figure out, do they have a small cup or a big cup? And are they trying to seek it out, or are they avoiding it? And just trying to kind of break that down into steps so that you can better interpret what's happening rather than just saying no. Because quite honestly, if you just say no and take it away, it will more often than not manifest into some other type of sensory experience that they will have. Self-injurious behavior is one that often parents want more information about because it's very distressing. And I can relate to this. I've witnessed a lot of self-injurious behavior, and it is very distressing, and it can be something that parents don't feel comfortable to talk about or to admit to other parents, or even to bring up to their doctor, because they feel it's something that they just must endure. And it's just something about their child that they're afraid is going to be judged, or that them as parents are going to be judged. And I want to tell you that this fits within the sensory domain, because it really can look like that high intense input where, you know, we're hitting our chin, we're hitting the walls, we're picking our skin to the point of bleeding or pain. And this is a repetitive behavior often. And this can be exhibited by the children or the adults, I've worked with adults as well, that have that big cup to fill. So they just want to seek, they want that pressure, they want that touch, they want that vision, so that hitting the wall is actually very satisfying, or hitting their own body is very satisfying. And it's often in absence of another coping mechanism, and not understanding how their sensory system needs to self-soothe. And then we also have the children that have that hyper-responsive reaction. So that high level of cortisol gets released in the brain after prolonged stress. So every time you headbang or every time you pick, it creates more and more and more of a higher cortisol release into your brain. And then it takes less to exhibit that response every time. And this is why self-injurious behavior can look almost addictive for some children, because they get a big bang for their buck when it comes to the kind of input that they're seeking. And our hope is to try to find, you know, more safe and more productive opportunities for them to feel satisfied. So I've been talking here for a bit, and I'm looking to our parents, our parent coaches, to maybe help us sort of walk through some of the common things at home. And we're going to look at home, and then we're going to look at school. So when we look at home, we think about sleeping, and these are some of the, I'm just going to kind of briefly go through them, and then we're going to see if our parent coaches can give us a bit of their experience around sleeping, teeth brushing, hair combing, and haircuts. All the things that we think should be easy, and they're not in many families' experiences. So sleeping, you know, obviously, there are lots of tools, but not all parents are aware that maybe a weighted blanket. There's been a lot in the news about weighted blankets, and a lot on Facebook and advertising everywhere. I think that weighted blankets are a great asset. Just keep in mind that they need to be 5 to 10% of your child's body weight. And a lot of the commercially available weighted blankets are much heavier than that. So that's where the sort of customizing the blanket weight to your child's weight is key. And there's lots online to read about that. But the vibration mats, the deep, like the nubby balls that help to give massages, tight sleeping bags, the tent beds, the body pillows, crib vibrators, cooling mats, sound machines, smell diffusers. These are all things that many families find can be helpful. Teeth brushing, so using things like visual aids, whether or not that be on an iPad or actual visual pictures, to help kind of give the steps and the predictable times, vibration or regular toothbrushes, music to help kind of soothe during that time. Or you can even find music toothbrushes that continue. That outer facial massage, so that's really being able to give that sort of deep pressure in through the jaw and up along the jaw under the ears before you're going to teeth brush, because it just helps to desensitize the muscles in the face. And using a hand under or over, depends, but sometimes kids prefer to go under, and to have you drive the brush or the toothbrush under rather than over their hand. Using deeper touch versus light touch. I had a girl last week that I was able to help her. She's like 12 and hasn't ever tolerated brushing her hair. And it was because her experience was people going quick and light with the brush. And what we actually found was her using a brush with bristles that she could actually put her hand on top and push the brush through her hair with deep pressure. She could actually tolerate that much better and wasn't having that fight or flight reaction. And so it was quite the opposite to what her family had been trying. And because they were thinking that they were, you know, doing the best for her. And in actuality, she found that input to be more stressful. So it's great that she had that opportunity to experience something different. But things like flavored toothpaste, using a nuke brush, which is avoids the bristles, but just has the little nubs that you can buy at Shoppers Drug Mart or at Toys R Us. Hair combing, so as I mentioned, a heavier brush with a bristle versus the light strokes. Giving children, like, we're going to do this 5 times, rather than just this endless amount of time, sit still till I comb your hair. Using visuals, like even a mirror, giving them some head squishes, massages before you do it, and doing a countdown. Children like to know that I need to experience this and it's going to end. And haircuts, you know, once again, putting your hand on top of the tool and pushing down, also getting them to pass the tools to the hairdresser can really help. That earplugs to help block out the clipper sounds, or weighted vest during the time. I'm sure that you can kind of think about the dentist, and they put those big weighted blankets on you to, or capes for the x-ray. And a lot of kids, you know, can be quite calmed by that at the dentist. So, you know, think about that every time you go to the dentist, not just during the x-ray, but wearing one of those weighted capes can sometimes help kids when they're just getting their teeth inspected. So I don't know if Nikki or Lisa want to comment on sleeping or teeth brushing or hair combing or comments or haircuts, to see if maybe there's any of those strategies that you guys have tried to, you know, or anything different that I haven't brainstormed here for the presentation. You guys have anything to add?
I can speak to sleeping. So one of my children really likes to feel crowded in bed, but doesn't like the weighted. So she sleeps with a lot of stuffed animals in close proximity. So I don't know, when I was little, I used to like when my parents would tuck me in and roll the blankets underneath, that kind of feeling. So with stuffed animals, as well as we have a sound noise machine hybrid that also has like an internal glow and has different nature sounds that they're enjoying. And my other child is not very, doesn't like a lot of dark. He needs backlit light as opposed to a lamp, because that's too harsh for him. So it took a lot of investigating, a lot of different tools, and we finally figured out something that works. And now it's a little bit more predictable, just with my daughter, sometimes depending on, because she has a clothing issue as well, depending on the type of pajamas and how when she twists and turns, it ravels up or moves up her body, she gets very upset about that as well. So just some things to consider, that it's not just, it can be 2 issues in one routine.
Absolutely. Very well said. I think that it's really about just trying different things. And I know that I didn't even know that there were cooling sheets and cooling pillowcases out there until I met a teenager who just, her dysregulation came out in a sense of always feeling hot. And once she had the cooling sheets and the cooling pillowcases, and she even had a cooling cloth that she took in a little canister to school, that she, just like a face cloth size, that she could take out if she felt hot or red in the face. Then so it's sometimes those things where you get a hint of what a child, take their words, take their reactions, and think, okay, what might help with this, right? If they're talking about hearing you and dad, your mom and dad talking downstairs, maybe one of those sound machines might help to just create an environment that they don't have to filter out, and they don't have to listen to every little sound that's going on. So yeah, taking your child's lead and really being able to recognize that is something that that probably, it usually gives you a hint, a clue, and to kind of go from there. I'm not sure if our other parent, if Nikki wanted to add into any other comments, or maybe she would have a comment on some of these areas around washing. So, using sponges, puffs, bars, like some children can't tolerate bars, but they can tolerate the liquid soap better. There are the smelly foam soaps like shaving cream that you can get at Walmart. Using a lot of cosmetic mirrors, like those little mirrors, so that children can see what they're washing and they can look at their body when they're also being touched. It can really help them process better. Counting with a song, once again, using visuals so they know a beginning and an end. A lot of children do have a difficulty with refusing or not wanting to wear the same clothes after they've worn it once. So tight base layers are really key. So using things like Under Armour and the Lycra dance suits and things like that, the bike shorts, the tight, without the seams, that sort of more tight, more Lycra feel. Often if you use that as a base layer, you can then put the other clothing on over top, and it helps that child feel that constant feel of pressure throughout their body, and then they get that undesirable layer put on top. Using underwear and socks where it's inside out helps decrease the seams. And using color-coded clothing can help, preferred fabrics, removing labels. There's a lot of sensory-friendly clothes out there. Mind you, they can be expensive, but I do have some of the websites on here for you to see. And then around eating, so a lot of times children really want that pressure into their jaw, and so they prefer the crunchy foods. So that can lead you into, okay, why do they really want those crunchy foods? And sometimes you can alternate the crunchy foods with the softer foods that you're trying to get them to eat. Divided dishes to help them with a more predictable routine, weighted utensils, weighted cups, those nuke brushes like I told you about that have just the little nubbies on them rather than full bristles. Different temperatures. It may not occur to you that a child would like warm applesauce or warm orange juice, and to change the temperatures, that's usually a very good one. Using that facial massage along the jaw as well. Using unexpected scents or spices. So sometimes, if you have a scented candle going that they like a vanilla or something like that, when you're also cooking broccoli, it can sort of help them focus more on the scent that they enjoy. And following like a more country style way of putting food out. So putting it on a big turkey platter with all the different foods that you're trying to offer, and everybody help themselves at the table rather than parents serving per portion on a plate. It just allows the child to have more control and more access and more exposure to foods. And that can often be setting up a stage for more self-exploration. So Nikki or Lisa, have you guys had any experiences with these domains of home life?
My daughter, for washing, she requires a shower head that has like a rain spout, as opposed to something that's a little bit more hard water kind of approach. And it has nothing to do with the feeling, it's the sound. So she prefers the rain trickling on multiple surfaces at a time. And that kind of, I think that muffles a lot of the echo in the bathroom, but it works for her, so that's great. And eating is always an issue. I have one child who wants to put hot sauce on everything, and I have another child who only wants to have macaroni and cheese every night. One of the biggest things we went through with our kids was milk was too creamy, so we had to add water to it, but they knew if we had water first, because there would not be any bubbles in the milk. Because if you have milk and then you add a little bit of water, it would froth a little bit. So that was the telltale sign for them.
Over here at our place, so my son Brody is really not a fan of the shower at all. So we tend to stick to baths mostly, although I'm trying to build his tolerance to having a shower. So in the bath, it seems okay as long as I'm not pouring the water over his head to wash out the shampoo. So I just use a little bit of shampoo. I keep his hair short because it's just easier to manage that way. And then I just rinse out the soap with a washcloth instead of dumping water over his head. And that seems to reduce his anxiety on that. And then what I've also found is through the summer, it's kind of nice with the splash pads running. We sort of try to practice that being around water that's falling like it would out of the shower. So I'm trying to build up his tolerance to that sort of water falling on you, so that as he gets older, we can shift from a bath to a shower. Eating is definitely a challenge around here too. I think we probably have maybe 6 foods that Brody really enjoys. And I just try to be patient about it and if I am trying to introduce something new, I just do it over and over again without even an expectation that he touch it. If he leaves it on the plate, the first 3 times it's on there, 4 times, that's great. If he picks it up to smell it after that, that's a big step too. There's no rush that just because it's on his plate that I'm, going to make him put it in his mouth.
Right. Yeah. Just realizing where your child's at and then working from there. And I often use the tag system where you just kind of go through the exploring first, where you're just providing it without any expectations, and you pair it with something that they prefer, and sort of, work from there. And I think that's a very good point about just not rushing it, and seeing that, children can really only control what they eat, their bathroom, and sleeping. So, eating can be one of these areas that can be a lifelong area of control. So we certainly don't want to make that a negative experience, but I can also appreciate that increasing diversity of food is helpful. And just to go back to the showering idea, the reason why kids like the whole body bath is because those hair follicles on your hair, like on your skin, they're all registering the information at once. And it's proportionate and comparable throughout your whole body because you're sitting and you're submersed. Whereas when you're using the sprayer, it may touch one part of your arm more than the other arm. So it's that unpredictable touch that is the challenge. So Nikki's strategy on experiencing things like the splash pad that are probably a heck of a lot more motivating than the shower, but often we'll find that you'll start in the bath and then you'll use the hand sprayer in the bath, right? But don't take away the bath until they're ready. There are also, for those that have your picky eaters, we also do through CTN have a couple different groups that run throughout the year at different times, and you can look on the CTN website and on Facebook to see these different camps. They are pretty much free of charge in most cases, so this is a great opportunity for you. So the Yummy Tummies group that really helps you go through the stages of helping to increase the diversity of a child's food, and there's different age ranges. So far, we've run the 5 to 9, but open to whatever ages can work. And then there's also in the York region, looking at the Food Explorer Summer Camp. So be watching for these things to help with mealtime, because we know that this is also a very stressful experience, often more so for parents and caregivers, and particularly when it's intergenerational families and you have a lot of grandparents and maybe caregivers that are from a different generation and feel like, we should just sort of force feed. And we know that with these children that it's not just a silly reaction, that they actually are feeling a legitimate fight or flight response. So it's important to, be sensitive to that. And I think that, you know, some tips for family outings and when you're kind of out and about and getting prepared. So, you know, offering that noise reduction time. So before you're going to go into a loud setting like a family event, you know, try to have some quiet time just before and use things like gum or a noise reduction device, or a timer to help them realize that, you know, we're only going to go into this area for this long, and you can use, you know, noise reduction headphones, you can use gum, you know, you can go to a quieter area, and just trying to help them moderate that. My son recently has had a concussion, so I really had to learn about noise reduction in many different ways. So it's definitely something to be mindful of. Wearing a deep pressure vest or a weighted vest, you know, before you're going and during a trip to a store or a restaurant, you know. So typically you want to wear a weighted or a pressure vest for about 20 to 30 minutes at a time, which should get you through a large chunk of an outing, like or eating at the dinner table with family. And really using the weighted shoulder wraps or weighted animals. These are all things that you can just shove in a backpack and take into a restaurant, and nobody's going to notice that you're using a weighted product. They're going to notice a child that's dysregulated more than they're going to notice you using some of these tools. So they're really things to try to embrace, and maybe taking a movement cushion with you to a restaurant or a family dinner. Using novel tactile toys. So, you know, using smaller pieces of putty, some little pieces of Lego, like just kind of gather a little tactile bag, but don't let them have it at any other time other than when you're in these experiences, so they remain novel. And one of the things I would always have in my purse would be a small little nubby ball, like those dryer balls. You can get them that are softer at a lot of stores like Winners and Marshalls and sports stores. And they're really great because they often allow you just to give that little rubbing and massaging through their hands, through their palms, through their backs, just to help them kind of stand in line while you pay or stand in line at the bank. And then really using the first this, then that idea, so that children can know that first we're going to go to the milk, you know, the freezer section, and then we're going to go over to the toy section or whatever. So just helping them make it a more predictable experience, and using a visual timer on your phone can also help them recognize that, yep, I'm not staying here for the rest of my life. I'm just going for a short period of time. Have Nikki or Lisa, have you guys had any success with these kinds of strategies, or can you add any?
I can, for my son, his just for our outings, his issue was really clothing and textures, and if he got a drop of water on it, or if there was a stain on it, we just had to really be prepared for an extra pair of clothing for him. And it had to be pants that had the right texture for him. And you know, he liked to pull sleeves down. He wouldn't wear short sleeves for a really long time, so we always came prepared with that extra pair of clothes, all of his favorites in our emergency bag for any outings. And, you know, at grandparents' houses, he would have an extra set of clothes and things like that, so that we were always prepared. Because if something, when, you know, he got set off with water or something unpredictable happened, you know, he didn't wash his hands and it all went up properly and it all went up his arms and his shirt got wet, we would have a big meltdown, and the whole day would be, of course, not as successful as we would like. So preparing clothing and having backup was our big one.
Yeah, thanks, Heather.
And I think sort of to add from a different, coming from a different place on this, is that if you've planned to go out, whether it's a trip for the day or a dinner or something else, and someone's not having a great day, whether that's your child is really dysregulated or you're feeling really stressed out, it's okay sometimes to just change that plan and stay home, or do what works for everybody. Because what I do know is that anytime I've tried to plan something, if I'm already like up here with my stress level, there is no chance that I'm going to help Brody be calm out anywhere if I'm not calm. So just giving yourself permission as a parent that even if you have it all planned out and you thought this was all going a certain way, if things start to fall apart, you just have to just really think about what is it worth it to you to go and try regardless, or is it better for everyone just to, you know, stay home and do something that's more familiar to everyone and try again another day when everyone's in a better place.
So really you're speaking to that kind of co-regulation and really recognizing that you're that bridge between, you know, what could be happening for your child and what could be happening even in the environment. And sometimes that choice, that plan just has to change.
Right. And a lot of times you end up being more stressed out about going out somewhere than you are just in your own home with what's happening.
Or other people's perceptions of you, right? So people in public, family, you know, what are they going to think if I give in to my child when that's really not what you're doing? But to them, you know, that's how it looks. So really being able to sort of feel comfortable with your decisions and not being as susceptible to that potential fear of what others are thinking of you.
I know
Absolutely.
for my family, going out to dinner means we're going to the Mandarin, and that is our only option because my daughter is a picky eater and because my son likes a lot of stimulus and needs movement. It's perfect. She gets to pick what she wants to eat. He gets to get up and walk around, and they have lots of different visual, auditory, a whole bunch of different stimulus, or not, if they wanted to stay with a parent while someone else goes and gets their food. Also, everyone else is kind of busy doing their own thing. They don't pay attention to what your kids are doing. And then they also have the fish tanks too, which is nice. But for my daughter, I carry around a sticky pad. So when you go to the automatic toilets that flush while you're still sitting on them with the sensors, I just put a sticky pad over that sensor so that she feels a little bit more confident and a little stable and grounded on the toilet without it flushing underneath her.
Very inventive. Sounds like you've had some bad experiences with that and you had to think of something on the fly. I think we underestimate how we come up with strategies on the fly, and it's because you understand your child and you understand what the stimulus is that is provoking that response. So it's really being able to, because children can't always vocalize what it is. If they can tell you, great, but that may not be a luxury that we have. So some of the clothing and the like the clothing and the toys and the tools, these are some of the common websites. We'll make sure that particularly that this list, you know, is accessible to you following the presentation. But it's just good to know if you're thinking about, you know, you've heard about things or you want to try things, like you want to get some chew necklaces, or you want to get a weighted blanket, or you want to get a pressure vest or some compression garments. These are some of the common common resources that you can use. And these are also some of the the highlighted ones are the common sites that the school boards use. So in terms of school, I know that this is a place where our children spend a substantial amount of time in their life. And I know that we have heard terms like sensory diets and sensory programs, and I want my child to have sensory at school. And so hopefully a kind of systematic program has been sorted out to figure out if your child has a small cup or a big cup and what kind of input they need or what kind of input calms them. But this slide is really speaking to sort of a little bit of a mindset change within the school system. So having done this for 25 years, I can say that there was a time when any child that had a sensory need, they were taken to a sensory room. And this may look like a room that has big balls and trampolines and, you know, just different gross motor type of equipment. But what we've also come to learn is that it isn't always about more. First of all, some kids need quiet offloading time, not just more stimulation. And then we've also learned that percentage of children that need to go out and be withdrawn from their social experience, their learning dynamic, and to go to a sensory room, we know the logistics in the school system is that needs to be timed, that needs to be supervised, and that needs to be very directed in order for it to be effective. It's not a time that we should be really focusing on other goals like socializing, things like that. Not to say that taking a friend isn't sometimes helpful, but sometimes that overstimulation can kind of derail the whole goal. So my point is that we're trying to do a mind shift change, that the majority of the strategies for your child's sensory needs we're trying to shift that into the classroom setting so that it's infused into the daily learning and that they're having opportunities when they need it and as often as they need it and have access to it whenever they need it, and versus waiting on 2 pre-scheduled times to leave the classroom. A lot of children can't deal with transitioning out of the classroom. They may enjoy the sensory experiences, but it doesn't do a lot for the longevity of their focus and learning. And the whole reason why we do sensory programming at school is to enhance the learning readiness. So the choice of activities plus the location of activities and the timing of activities is what makes it successful. So we're really trying to do a mind shift change. Somebody's got muted.
Come here.
Are we muted there? Sorry. So what we're trying to do is we're really trying to help emphasize that we're having more in-class strategies first. And then we are moving to a near-class strategy, and I'm going to explain what each of these are. And then the out-of-class is really the last resort. So these are the kinds of tools that we have in the classroom. So things like air focus cushions, rocker reading chairs, ball chairs, weighted lap pads. We also have things in the near class environment, which are offering movement. So the pink cards, there would be a selection of to use, would be more movement-based activities. And then the blue cards move into more deep pressure activities and then some deep breathing. This is the greatest thing I've seen in schools most recently, and you'll start to see in your schools as well, is these floor circuits. And it's a great way because these are tools that are good for all. It is not prescribed per se. It is, all children are using them to go to the bathroom, to come down to the office, to take attendance. It's offering lots of visual, step-by-step sort of procedural type of activities, whether or not it be a wall circuit or whether or not it be a floor circuit. But these are what we mean by sort of near-class strategies. And then when we talk about out of room, the sort of top tier, this is what I was referring to, sort of in a room that's sort of segregated and has a lot of these great activities. But if it's not essential for your child to have this kind of input and would benefit from the in-class and the near-class, then I would highly suggest that, that you give that some thought, because in my experience, it's much more effective. So when we talk about in-class strategies and we talk about movement, some of the pictures on here can be things like a focus stool. These are very increasingly popular now. Teachers are often having what they call dynamic seating or flexible seating. And they also have rolls on the chairs to let the feet roll back and forth, or bouncy bands, which are tight bands on the bottom of the chair so the child can kind of push through and kick through. So if they're those real seekers of needing more input, then they can get that when they're seated and when they're doing their work. So we're looking to find strategies and equipment that they can use to be able to stay within their learning environment. A stand-up desk is another good option. These half turtlebacks, which we call stepping stones, they are nubbies, and 2 of those can go underneath the chair for children to push and to squish, and it really allows a child to feel more grounded, know where their body is in space, and prevents things like rocking the chairs and getting up and down and leaning over in the chair. And it's really giving them what they need, but in a more productive way. So these are some of the tools that we're, that we're introducing into the classrooms. When we look at sort of that calming, deep pressure and focusing tools, it's really about getting that input through the muscles and the joints. So we do things like TheraBand tuggers, so a piece of TheraBand that is tied onto their chair so they can pull it. That bouncy band, which is on the lower right side with the feet pushing through. Oops, sorry. Looking at weighted items, so things like medicine ball activities, that would be more out in the hallway, but a weighted vest, a weighted lap pad, shoulder wraps, so it looks like a little seat cushion that goes around your neck, weighted pencils, weighted gloves. We also do the same ideas with pressure, so that could be in the vest, it can be in the forearms, it can be in the wrist, it can be around the head. Some of my kids that are head, like they are often banging their head, we will use things like head wraps to give them that input, that tight feel through their head. And we'll also, that nubby ball on the lower right, we'll also take, for kids that hit their chin and hit their heads, we'll use those pliable, squishy nubby balls and give them lots of that squishing input into their head, into their jaw, their forehead, and it really helps calm them. Using stress ball activities, putty activities, which is like a resistive putty, not just like a Play-Doh, but it's stronger. Doing things like calming poses, like yoga, weight-bearing stances. That would be things like a flamingo stance when you're on one foot and you're holding your body or moving your body into a shape of a tree. And using like a horseshoe table as a desk, so kids will stand and lean and push their elbows into the desk. This is so much more inventive than having kids just sit and be still for 7 hours in their desk all day. Like it's allowing kids these opportunities is what's helping children become more successful. And in terms of the auditory, so we've probably seen the traditional headphones, but this picture here is more of like a headband earplug type of device that some kids are enjoying. Some kids don't like the light because they're very light. So some kids don't like the feeling of inner ear. Some kids prefer over the ear, and that's okay. But using white noise on either a MP3 player or a computer, and using gum chewing. The gum chewing helps to really give that calming noise and pressure into the inner ear. So it helps to combat that undesirable sound that they're trying to camouflage. Pressure, headbands, compression, a concentration station. So just basically like a quiet office area. So a lot of teachers now are putting in like a secondary workstation, which is awesome. There's also volume meter apps where the whole class is being shown a picture of a windshield, for instance, and when the noise gets too loud, the windshield cracks. And if it gets really too loud, then it breaks. So there's a lot of these really great visuals that can help keep the noise down in the classroom and help moderate everybody's volume. Auditory timers. There's many different types that can help to help children have more like awareness of when something is going to come to an end, and lots of deep pressure activities. We do know that deep pressure really does help to combat auditory. Those two systems in our 7 senses, they really do tend to connect. So lots of that heavy body hugs, desk push-ups, palm presses, the weighted items can really help with kids that are auditory sensitive. And a whisper phone, I did this with a child this week where they really just were entertained by the sound of their own voice, which I thought was lovely. But they often felt they had to really accentuate their sound. So instead we just gave them a whisper phone, and often this is used in speech and language. And it's basically just a hollow piece of tubing that they can, whisper into one end, and it gives them that biofeedback through the other end into their ear. And so they just love to hear their voice, but they're not so loud in the classroom. When it comes to the tactile, there's just lots of easy things like a textured ruler, textured pencils, using rubber bands on erasers, stress balls, whether or not it be foam or gel or sand, wiki sticks. Wiki sticks are like small pieces of wax that kind of look like pipe cleaners, but they're wax, and you can roll them up into small balls. They can twist them on their fingers. They're very discreet at carpet time. And the fidget digit is like a little gold ring that can roll on your finger. And a finger squash it is the items on the top right, that they're air-filled pockets, and as you squish them, the color moves from side to side. And keychains are a big one for the tactile. And I even have a boy this week as well, or last week I should say, that we just used small rolled pieces of masking tape and on his fingers, and that just kept him highly entertained, and it's still working a week later for keeping him at carpet. And this is a child that couldn't manage like a stress ball or or a fidget because they would just throw it, but keeping the sticky tape on his fingers became very organizing. So being creative, inventive is always key. Oral is something, as I mentioned earlier, it seems to be when kids have oral responses, the first go-to is wanting to put something in their mouth to replace it. And I want to emphasize again, it's really important to make sure that the oral isn't just manifesting because one of their other sensory systems is unregulated, because that's usually a sign of self-soothing. So in the event that they are seeking, they're those seekers and they need more of that input, gum chewing is good for that inner ear pressure, raisins, dried fruit, carrot sticks, pretzels. Some of the jewelry is the coiled necklaces and bracelets, but there's also an abundance of these pendant necklaces that are just very cool and very socially acceptable, and they're just great replacements to chew on if they're chewing on other items. Using ribbed sports bottles to help suck and chew. So like the hockey bottles rather than the silicone ones that they usually break or chew off within the first week. And parents who have replaced lots of bottles, water bottles can probably attest to that. Things like the cheap plastic coffee stir sticks, that they're good to chew on. They may not be okay at school depending on your relationship with your school, but certainly at home, getting them to sort of chew on those stir sticks. They are very pliable and they're very they don't break very easily. But of course supervision would be needed, as it would be for any of these oral strategies. And oral exercises like just fish puckering their lips and, you know, having a little mirror and having them do those little oral exercises and making sounds is key, as well as grazing on snacks at transition time. I have a little boy I had in kindergarten, I have him again in grade 1, and he would just pick up all the little pieces up off the floor. He would pick up rocks from outside in the schoolyard, and we introduced Mentos and Starburst, and those weren't my choices. The parent found those to be the most successful. And I must tell you, for such a little boy, and all the teachers saying, no, this isn't going to be a good option, he'll just keep eating candy all day, he really regulates well and maybe only uses 1 or 2 pieces a day. And it's really helped to cut down on some of replacing some of that unsafe behavior. So if we look at visual, we have a lot of things in class like foldable desk carrels, like just the cardboard type of, they come and go and they're just little desk visors, using visual schedules or break cards, making sure that your seating position is really considered, because if you're having to look through 15 other bodies to see the teacher, it can be very distracting. So you really want to consider where they're seated and not in the busiest area or by the window if that's a distraction. Taking away a lot of the decorative borders on handouts. Making overlays, so you can just take some cardstock and just make little windows, and then that can just sit on top of a math sheet where they're just seeing that 1 or 2 questions rather than seeing the whole sheet. And you can also cut those up in, you know, worksheets into smaller pieces, and you can also use highlighters to really pinpoint where you want the child to focus. You just decluttering their desk. I can't say enough about this, just using things like magazine stands, desktop tool holders, like for your pencils and your scissors and that kind of thing, rather than a pencil box. And light filters. This is one that not a lot of parents have maybe had experience with, but on the top right there in the picture, it's a fabric swatch that is with magnets and it connects to the lights. And it just helps to cut those high fluorescent rays down. Using lots of multi-sensory tools like gel pens, erasable pens, bold markers, and just lots of those visual types of fidgets. So whether or not it be water tubes, glitter tubes, marbles, that they can look at the reflection if that's what the child needs. So you can see that there are a lot of different ways that you can meet the needs. It's just identifying for your own child. And, you know, smell is always a hard one, but I mentioned earlier about, you know, things like scented hand sanitizers and creams, smell sticks, which you can buy like little aroma sticks, smelly markers, stickers, paper, aroma sacks, like essential oil necklaces and bracelets, and even just taking the essential oil and just rubbing it on Kleenexes, and they can tuck it in their sleeves and pull it out when they need to. So really being inventive about smell, but also knowing that and being mindful that schools are a scent-free environment. So you just need to review that with your school to make sure that it's more local smell rather than diffusing out into the hallway, which some essential oils can do that. And then, you know, just I think pausing and really taking a look at how sensory programming can be more effective. And we've talked a lot about, you know, prepping before you leave home, expanding your definition of sensory intervention. So recognizing that, you know, that sensory is not just taking your child out and going into a sensory room. It can also be the teacher who does yoga stretches or mindfulness exercises at every break. When they come in from recess, you know, she has them do these deep pressure stretches. She has them do body stances to help them get regrounded and organized. And really focusing on terms like, we do these things to be refocused. We do these things to calm. We use this ball to be in the green zone. So we do these things. It's not using the word sensory. The word sensory is so subjective. It doesn't give children or caregivers really any descriptive understanding of this. It's really much better to talk about so refocusing would be more like the movement activities, and calming would be more of like the deep pressure and the quiet reduction time. So really helping the child, and I have to emphasize that I really feel that the physical strategy is only half the battle. The child understanding why and when to use these tools is everything. And I always stop and ask a child when I see them, so why are you doing these things with Mrs. Smith? Or why do you have this in the classroom? And you really pose those questions to them so that they can really say, well, it's because, and if they don't know, then you teach them a script so that they can start to absorb that and be able to speak to and advocate on their own behalf. And tracking the effectiveness and the impact of these behaviors and reactions are key to helping any sensory program be effective. Sensory regulation, it needs to be taught. Self-regulation is actually one of the domains in terms of the success criteria at school. So it's one of the domains that schools are adopting and trying to really develop and emphasize, and there's an acknowledgement of it on the impact on learning. So we really have to first of all distinguish, okay, what is the sensory disturbance, but also what are the sensory strengths? I should be adding there, because you want to know what is actually working, what are their tools, then using and teaching them the tools, and then creating it to be in a visual way, in a toolbox. So if they're older, it can maybe be like a written list, but if they're younger, it can be in the form of pictures, and really helping them draw those connections. So, you know, when it feels loud in class or in Walmart, we try to use our headphones or our gum. So we always pair, instead of just saying or doing to them, we have to pair it with, why are we doing this? What state do we want to see change, and what do we want to observe from this strategy? And if you pair that cognitive connection with the physical tool, you will see much more benefit for your child. So this is the concept of the zones of regulation with the 4 different states. So the 3 on the left are the stoplight colors. So green is the ideal state that kids want to be in. Slow is when children are starting to, when they're in the yellow zone, they're starting to become silly or frustrated or upset. And then when they're in the red zone, they've kind of checked out of the learning. They've already disengaged. And the blue zone is really that area where it captures a lot of more of those emotional or physical aspects related to more health. So the idea of the zones, and for parents that are just seeing this for the first time, there's lots on the web to see about this program, but this is actually the curriculum, one of the main curriculum options that the school boards have chosen to teach children how to self-regulate and self-moderate and self-assess. So becoming familiar with this and teaching your kids to use this, also you pair that with their tools. So on the bottom, you would, you know, identify what are the tools that you would use in each zone. And this is one that I created for a child some time ago, and we kind of said, okay, for you, what does the blue zone look like? What does the green zone, yellow zone, red zone? And we identified the specific tools so that this child could self-advocate for themselves. But also, as an aside, it helps continuity from year to year with teacher to teacher. So it really helps say, okay, this is me, and this is my child, and this is what works. And, you know, please feel free to add and to modify as need be. Creating break cards, helping children distinguish between avoidance and a break is really important. So, you know, because you're wanting to leave, or you're wanting to, you know, sit over on a beanbag chair instead of at your desk, is that because you need a sensory tool, or is that because you need the directions repeated? So just really breaking down to find out, you know, how can a break card be utilized? And there's different ways. They don't need to be fancy. This is just one that I did a combination of hand drawing and pulling pictures off of websites. Like it doesn't have to be fancy. It just has to be understood and meaningful for your child. And so a lot of parents will ask, when do we refer to OT? So we're just going to close up this part of the presentation so we can open the floor to questions. But, you know, when there's like an observed or a suspected sensory issue affecting performance. So just because a child has a sensory issue, it doesn't necessarily mean that it's a bad thing. It's just the child's coping strategy. So it's only if it's really impacting their performance at school with, you know, playing because they're hitting others. And so you really need some solutions to help with that. If one of the other consultants, like another healthcare provider, a resource worker or teacher, a board staff consultant, a psychologist, a counselor they've identified a need, feeling that that would help kind of work within the 3 domains of self-regulation, then by all means, that's a great referral. And, you know, looking at making sure that all basic medical explanations have been ruled out. So dental needs around chewing and non-edibles, and medication changes for increases in aggressive behavior. So just making sure that you're considering that before even making a referral, because those could be, you know, outside of the domain of OT. And final thoughts. We've discussed that, you know, an organized central nervous system will increase self-control and readiness for learning. And we know that self-regulation involves the physical, which embraces the sensory, but also that emotional and cognitive strategies are equally as important, even though we haven't given a lot of emphasis to those last domains, but I can state that those are equally as important. And embracing or replacing more like a less functional behavior with versus just saying stop it. Because if you just say no, the reaction, it isn't always going to be a purposeful response. And sensory dysregulation is real, and it requires tolerance, and tolerance from the parent, as Nikki explained earlier, like tolerance and recognizing yourself and how you're projecting to the child is key, and knowing that you know, it sometimes needs to just be dealt with, like you just have to cope with it and live with it, and sometimes it needs to be changed, but knowing the difference will help you from not feeling like you're not doing a good job. Reactions can vary according to environment, so they could be good at grandma's house but terrible at aunt's house. Be tolerant and inclusive about the coping strategies. Empower yourself with knowledge to be that detective and understand why and how you can help. And you're not going to always get it right. I don't always get it right, but the trick is that if you can even if the child can have the confidence that there are other strategies that can help them, they're going to be more open-minded to other things, and they're going to be having more exploratory behavior to find those things themselves. And taking care of you, since if you as the adult isn't regulated, you can't assist with that co-regulation. And really embracing your parental judgment. I feel like, you know, as a therapist, I mean, I'm a parent as well, but as a therapist, I don't always know the right answer, and the teachers don't always know the right answer. But keeping open-minded to having different people give you feedback about what they're experiencing with your child is key, because in working with schools, they have a lot of experience. I have to tell you, they don't always get it right, but they have a lot of experience. And if they are experiencing something with your child, it may be something that, that they're able to produce in that environment and not at home, and that's okay, and vice versa. But being able to be open with the schools, and you'll be able to get your wishes heard if you're able to offer suggestions more often through the child's perspective rather than as a parent perspective. So putting together like an all about me, or putting together, my toolbox, and helping the child prepare that and share that with teachers is the best way to get the information to filter from year to year, because I can appreciate that that's a big frustration, is going from year to year. It's for teachers as well. But I think we're all in this together. It really takes a whole community to help children be successful, and particularly with sensory, because it does feel so subjective, but yet it feels so real in all of your lives. So I really hope that the information that we've spoken about tonight has helped enlighten you. I know that you're going to probably want to revisit the slides, and we're hoping to open those up for you to be able to sort of be that detective for your own child. And do know that some of the upcoming events at CTN, as I mentioned, those different feeding groups and many other events that Heather, I'm sure, can speak to better than I, are available on the CTN website. And I know that Heather has also highlighted as well that there are calendars of events. This is not one to look at in particular because it's changing month to month, but do be aware that there is lots of different types of activities and groups to be a part of. So Heather, I don't know if you want to take the floor from here, but I really do feel it's a privilege to be able to be here tonight and to share my my professional experience, and I really see it as a partnership with both parents and teachers, and yeah, it's been a pleasure. So thank you for having me.
Thanks a lot, Kim. We actually have some awesome questions, so I think we'll just jump right in and use our time wisely. So Stacy asked, can one child be both hyper and hypo responsive at different times or in response to different experiences?
Absolutely, but you tend to see more. So why that would vary would be because maybe the environment is different, the amount of sleep a child's had is different, whether or not they've eaten, whether or not they're emotional about something. So of course you can sort of see differences, but so usually if you're kind of trying to decide if your child fits within one of those hypo or hyper domains, it is usually when you see patterns. So if it's just a one-off, then it's likely not as much of their profile. But if you're seeing regular variations, then sure, it can be impacted by all of those external as well as internal experiences. But often you'll see that there will be a pattern, like a child, so for instance, wouldn't become tactile defensive one day and then another day not be. They may be less because they can tolerate it better because their emotional, their cognitive system is better balanced, but it generally, you won't find extremes.
But Kim, I know other families had this question too. A child might not fit into always hypo.
Yeah.
Right? And so your child could experience both the seeking and avoiding behaviors in different situations.
Oh, absolutely. And particularly the seeking and the avoiding go together because those are active behaviors, right? So the seeking and the avoiding, those are I am doing something in my life, in my environment to get my needs met. Whereas that bystander and that sensitive sensor, they're passive. They're just letting the world pass on by, and they're just absorbing. So absolutely, there's a very strong correlation between the seeker and the avoider, because, and this is the profile that we see the most, and I think is the most obvious to people, is that they're the ones that want lots of movement, want making lots of noise, touching everything, but they also will avoid coming to the desk and working, or coming to the shower and having a bath, right? Or brushing teeth or whatever. So those tend to often go together. So it's not surprising that that you would see those two tendencies in one child.
Okay, that's great. Shannon had a couple of questions. I think Shannon's still on. So you talked a lot about sleep and a lot about sort of what different practices and different strategies children would use. Her son prefers to sleep on the floor, not the bed.
Mm-hmm.
Any insight into why he might like to do that? What is he maybe getting from that experience, and what could she do to maybe transition him back to bed?
So often when kids are laying on the floor, it's because, so it can be because it's cooler. Often it's cooler down on the floor because heat rises, but it's often more because it's not moving. Whereas a bed with a mattress, as soon as you shift or move, you get that vestibular system is activated. So if you're kind of dozing off and you're half asleep and you move your arm, the whole bed moves. So if you think about that big cup and that little cup idea, if you have a small cup for that kind of unpredictable movement below you, and you feel that shifting of your body parts in the bed, you could be getting very overloaded very quickly. Whereas if you have a child that's, rocking and rolling in the bed and shifting and moving, and I'm sure parents can think of those kids too, they are the ones that are, they're not afraid of that movement at all. They are seeking it. So it could be that I would be curious to know if also there's a fear of other kinds of movement, like things like, a swing, or kind of changing their head position, like wanting to often just be on not wanting to get down off of a curb, and like wanting to stay put, with more grounded. In terms of what you can do about that, I mean, having a firmer, less active mattress obviously could be one attempt, but even starting with something like a cot, that raises them even a few inches up off the ground, would just give them that sense of that little bit of, it's only giving them a couple inches up off the ground versus being a couple feet up off the ground, because really that's our relationship to gravity. And some kids can be very, very, very super aware of that feeling. So taking small increments, and maybe also pairing that with a weighted blanket or a Lycra wrap that's sort of on the bed, so that they can sort of have that surface or that item on top of them, because the bottom's moving. So something on top of them that's helping to ground them, like a weighted blanket.
Okay, excellent. Thank you. So Stephanie has a question that I know lots of parents struggle with: haircuts. And we had some really good suggestions in the chat, actually. So Dawn, thank you. And Stacy, thank you. Any ideas for haircuts? Her little guy is 3 and he hates haircuts. Mm-hmm. We know that there are some kid places that some of them are better than others. Any other tips?
Yeah, the kid places sometimes can be a double-edged sword, because they can have too much stimulation. Like they can have the TV going, and they can have the toys, and other kids that are having emotional reactions to hair cutting, and it can be very stressful. I would say, trying to have like a home hair cutter can be, like a hairdresser in a home can be a lot more controlling of the external environment, because the issues are not always within the child. Like I'll get to that in a minute, but to make sure that the environment is predictable and controlled, so that it's all of a sudden that next kid coming in and sitting in the chair beside them. And that's a lot of, like, those hair cutting places can be very overstimulating in that way. So, and I know some parents just cut their own kids' hair because of those experiences, but being in an environment that's the same, to start off with, obviously you would have to phase them out of that as time went on. Giving them a timer, so a visual timer on your phone, there's tons of them that you can download. And if you need to tweak it because you need to add time to it, you can do that easily without your child seeing. But the idea of the timer is that they know that there's an end to this madness. So it really does help them, especially if they get to set the timer. Having the hairdresser let them handle the tools and pass it to them when they need it. Staying away from the clippers because that tends to be traumatic. Like, just use scissors. You don't need to deal with clippers. Once again, clippers sounds is in the environment. So if you're in a place where lots of people are getting their hair cut, it's just better to be in a location where you can control that. Helping put, like, using a weighted cape or a weighted blanket on them underneath the protective cape can be just giving them that, or like a weighted animal they can have on their lap just to give them that sense of calmness. And also being able to use a lot more deep pressure. So kind of putting your hand where the hair is pulling. So if the hairdresser is putting deep pressure through their head, or the parent that's cutting their hair, hold the head down like with a squeeze pressure and then pull the hair and cut. What the issue is that kids don't like that tugging from the top, like from the actual hair that's going into the scalp. So if you can put that contrasting deep pressure, it's kind of like the idea that Lisa talked about with the bath, and that the bath just kind of gives her child that sense of sameness all over their body. And then when the kind of water trickles on them, then it isn't such a negative thing. Whereas, and that's the same idea with the hair cutting. So giving that counter pressure and then pulling the hair strands and cutting. And I have to tell you, like, I've had a lot of success with that. You just have to get a hairdresser, or yourself if you're doing it, to understand what that's doing for the child. The child doesn't like the tugging, and the hairdresser shouldn't try to go quick. They shouldn't try to go quick, 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 because when you go quick, it's a lot of light touch, and that can be very distressing. It's better to, tell them, I'm going to do 10 cuts. I'm going to hold the pressure down. I'm going to do 10 snips. And if you only get 10 snips done and the child is not having an adverse reaction, and I have to tell you, with hair cutting, holding your child down to cut the hair will not end in a very positive experience, because it is a loss of control. They have that fight or flight. It's very stressful. Instead, you need to prepare them, prep them, break it down, let them know how long it's going to happen, how many times it's going to happen, let them hold the tools and pass it to the person cutting, and letting them be in control. It helps them digest the experience more.
Stacy actually had a really good suggestion for her boys. When they were around 3, she'd bring a change of clothes so that they didn't have to wear the cape.
Ah, yes. Very
so
good idea.
Let them get covered in hair and then just change at the end so they wouldn't be irritated.
Yeah, I mean, the cape is really just a luxury to protect the clothes. It really isn't a necessity. Sometimes, you may take your weighted blanket and use that, and it's going to get covered in hair. But if you're prepared to wash it, then, it's just something that and also having your child sit on your lap, but giving them that sort of squeezing deep pressure around their body, not holding them, because that would be seen as trying to override, their power, but just giving them that kind of squeezing compression, kind of cupping around their arms and their body can also give them that calming input as well. But doing a social story where you're breaking down visually and you're doing a social story, there's lots online about a lot of free websites about doing social stories for your children. So breaking it down, when we go to the hairdresser, this is the first thing that happens, this is the second thing that happens, it's the third thing that happens. Once again, it's speaking to that cognitive and that emotional domain, that it has to be a part of this. There isn't a magic wand sensory solution. It is a sensory over or under reaction, but human nature is that, we have, as exploratory beings, we have to understand and be in control of what is happening in our body. And when you're already feeling out of control, you're going to even feel more out of control if you get held down.
I think we just have one more question. One of the moms would like some suggestions. Her child throws things a lot, and of course when it's soft, it's not as much of a problem, but when it gets harder and people can get injured, it is becoming a problem. Do you have any suggestions?
So I guess like there would always be questions relating around these. It's a great question. I guess my first thought would be, you know, is the child verbal or nonverbal? Because quite often language is a component of throwing. So, you know, and the age of the child, because we know that throwing is also a developmental stage that kids go through. So if there is any kind of developmental delay with a child, they may be still stuck in that stage longer than you would anticipate, as well as when they're mouthing things. I mean, young babies put objects in their mouth to learn about properties like, is it smooth? Is it cold? Is it hard? Is it chewy? Like they're exploring their world through their mouth. And it's the same thing with some of these stages of dumping, because dumping is a common one as well as throwing. And those are sometimes stages of just communication. So maybe not having a way to express what is happening for them at that moment and what their needs are. So it can be communication based. If it is enjoying the feel of the jarring, like chucking the toy and then the wrist kind of flicks, then that's more kind of indicative of maybe they need to have more activities, like go get things like a weighted ball and play some weighted ball games with them. It may be that they need to do some more climbing. They may need to do more, you know, bear crawling on the floor, getting more of that input in through their joints. It can, you know, also just relate to avoidance. And it could be related to some of those environmental situations, like it's every time the TV gets put on out of, you know, just it all of a sudden gets put on and then there's a response of throwing. Like sometimes you're not always aware that the throwing or the dumping is a response to something else going on in the environment. Either a light went on or the TV went on or somebody walked in the room. I experienced this a couple weeks ago with a little boy that was in his own classroom working on some just quiet calming activities, and his class rejoined and came in, and right away he just started throwing and things across the room, and he just got so dysregulated because he didn't have that predictable understanding of when they were coming, why they were coming, and it just became the stimulus was too overwhelming. So the throwing can be indicative of all of those types of things. So, you know, it would require sort of some more understanding of what was going on in that situation. But throwing can be very much a communicative issue, as much as it can be sensory.
Thank you. Those are the last of our questions. So I think that means that you've covered everything, Kim.
Oh, I don't know about that, but I do think that if we've made you think tonight and made you, hopefully you don't feel overwhelmed. Remember, you know, none of us do this perfectly. It's just having that little bit of more information, just thinking, oh yeah, you know, if you can just look through the lens of some of the things we've talked about tonight and hopefully interpret and evaluate your child's responses and really try to reframe the word behavior and realize it's your child's coping strategy, it's your child's approach that they're using to navigate, and until they're shown a different strategy, then they're going to keep using the strategy they're using. So just saying no is not always going to work. You have to offer that replacement and, you know, sort of help them reframe what their options are versus, because in absence of a strategy, they'll just make up their own. So that's kind of our job. All of our jobs is helping our children kind of come to terms with what might be some more functional and positive options.
Lisa, Nikki?
Yes, I think I just wanted to add that, you know, when I'm looking at sensory issues for my son, I try to just sort of deal with one thing at a time. If I try to start dipping into all the areas, then sometimes it can just be confusing and overwhelming for everybody. So really I start to prioritize what is it self-interest, does that go at the top, what sort of comes first. And the other piece I would just say is that even if you found a great strategy, it can take a while to develop you know, their acceptance of it and how to work it in everywhere. So not to feel that just because something didn't work the first or second or third time that it's just never going to work. Just things tend to take time. So just to be patient with yourself and with your children as well.
I think to that point too, Nikki, is sometimes the strategy is really working well and then all of a sudden it doesn't work anymore. And so I think just the ability to be a little bit flexible and realizing that, you know, the kids change and develop and need different strategies as they get older and navigate through the world. So
and don't lose the faith.
Yes, exactly. Lisa, how about you?
For myself, I realized that a lot of it, I can just ask them whether they're verbal or nonverbal, because they might come off with like a strange, outlandish story, but you have to remember that their sensory perception is their reality, even if you don't perceive the same thing. So what Kim had mentioned is that it's a reaction, and it might seem like it's not like it came out of nowhere or that they're instigating something, but it could be something that they are perceiving that you do not. And I do like that, Kim, you've mentioned this numerous times, is the level of expectation, because I find how my kids react, whether they're active or passive, depends on the level of expectation. They understand that there will be noise at Walmart or noise at school, but not at home in their own bedroom, right? So they might have different reactions to that as well. So yeah, talk to them.
That's great. Thank you very much. Thanks so much, Kim. Actually, we've had several families in the chat just pass along their appreciation to you for all the information. And a thanks to CTN for hosting it, which is fantastic. And I will be sending a follow-up email tomorrow. We won't have the video till probably next week, and I'll send that around again to everyone that registered. Please check our events calendar. I'll send you a link to that. I'll send you a link to our survey, and you'll have my information so that you could speak to myself or Nikki at any time in the future. We can pass along questions to Kim for sure. And Lisa is one of our amazing mentors, and we can always connect you with other families as well. So thank you. I don't think there are any other questions. Thanks everyone for joining us tonight. Stay warm, and we will speak to you soon. Thanks a lot, Kim. I appreciate it. We'll work together again.
Have a good evening, everybody. Thank you very much.
You too.